Your kidneys work around the clock, filtering waste, balancing fluids, regulating important minerals, and helping keep your entire body functioning properly. The frightening reality is that kidney problems often develop gradually. Many people assume that if something serious is happening inside their kidneys, they will immediately feel pain. In many cases, that is not what happens. The body may send warning signals long before a diagnosis is made, but those signals are often mistaken for stress, aging, dehydration, or everyday health issues. Ignoring these signs can allow kidney damage to progress silently. That is why understanding what your body is trying to tell you can be incredibly important. The earlier a problem is recognized, the greater the opportunity to protect kidney function and prevent serious complications. One of the earliest clues can appear in the bathroom. Changes in urination deserve attention because your kidneys are directly responsible for producing urine. You may notice that you are urinating more often than usual, especially at night. Some people experience the opposite and find that they are producing less urine than normal. The color may become darker, the stream may change, or urination may simply feel different than it used to. While these changes do not automatically mean kidney disease, they should never be dismissed, particularly when they persist for days or weeks. Another warning sign is discomfort during urination. Pain, burning, pressure, or difficulty emptying the bladder can indicate an infection somewhere within the urinary tract. If infections are not addressed promptly, they can sometimes spread upward and affect the kidneys themselves. This is one reason why recurring urinary symptoms deserve proper medical evaluation rather than self-diagnosis. A symptom that should always be taken seriously is blood in the urine. Sometimes the blood is obvious and turns the urine pink, red, or brown. In other cases, it may only be detected during laboratory testing. Healthy kidneys typically prevent blood cells from leaking into urine. When blood appears, it can be a sign that something within the urinary system requires immediate investigation. Various conditions can cause this symptom, including kidney-related disorders, making professional medical assessment extremely important. Foamy urine is another sign that many people overlook. Everyone may occasionally notice bubbles in the toilet, especially after urinating quickly. However, urine that consistently appears excessively foamy or frothy can sometimes indicate that protein is leaking into the urine. Protein normally remains in the bloodstream. When the kidney's filtering system becomes damaged, protein may escape, creating persistent foam. This symptom often develops quietly and may be one of the earliest visible clues that the kidneys are under stress. Swelling in different parts of the body can also point toward kidney dysfunction. When the kidneys cannot efficiently remove excess fluid and waste products, fluid may begin accumulating in tissues. This can lead to swollen feet, puffiness around the eyes, enlarged ankles, or tightness in the hands. Some people notice that rings no longer fit comfortably, or that shoes suddenly feel tighter than before. Fluid retention is not always caused by kidney disease, but it is a symptom that should not be ignored. Many individuals with declining kidney function experience unusual fatigue. This exhaustion often goes beyond ordinary tiredness. It can feel like a constant lack of energy that does not improve with rest. One reason is that healthy kidneys help support red blood cell production through hormone regulation. When kidney function declines, anemia can develop. Reduced oxygen delivery throughout the body may leave a person feeling weak, sluggish, and drained throughout the day. Along with fatigue, some people begin struggling with concentration. Tasks that were once easy may suddenly require more effort. Mental fog, difficulty focusing, forgetfulness, and reduced alertness can occur when the body is not functioning optimally. The brain depends heavily on adequate oxygen and balanced body chemistry. Kidney problems can disrupt both, affecting cognitive performance and overall mental clarity. Another surprisingly common complaint is feeling cold all the time. Some individuals notice that they need extra blankets while everyone else feels comfortable. Others find their hands and feet remain cold even in warm environments. This can be linked to anemia associated with kidney disease. When oxygen delivery decreases, maintaining body warmth becomes more difficult, creating a persistent sensation of being chilled. Your skin can also provide important clues. Healthy kidneys help remove waste products from the bloodstream. When these wastes accumulate, they may contribute to dry skin, irritation, and intense itching. Some individuals develop persistent itching that seems unrelated to allergies, soaps, or environmental triggers. While skin symptoms can result from many different causes, ongoing unexplained itching should not be overlooked. Changes in breath and taste may also occur. As waste products build up in the body, some people notice a metallic taste in their mouth. Foods they once enjoyed may suddenly taste different. Others develop unpleasant breath that persists despite good oral hygiene. These changes can affect appetite and make eating less enjoyable, potentially contributing to weight loss and nutritional deficiencies. Nausea is another symptom that may develop as kidney function declines. The accumulation of waste products in the bloodstream can affect the digestive system, causing a persistent feeling of sickness. Some individuals experience morning nausea, while others struggle throughout the day. In more advanced situations, vomiting may occur repeatedly. Because nausea has countless possible causes, people often overlook its connection to kidney health. Loss of appetite frequently accompanies these digestive symptoms. A person may feel full quickly, lose interest in meals, or unintentionally begin losing weight. Over time, inadequate nutrition can weaken the body further and create additional health complications. Paying attention to unexpected changes in appetite can sometimes reveal an underlying issue that requires attention. Shortness of breath can become a serious warning sign. When kidney function is significantly impaired, excess fluid may accumulate in the body, including around the lungs. This can make breathing feel more difficult, especially during physical activity. Anemia associated with kidney disease may also reduce oxygen delivery, contributing to breathlessness and reduced exercise tolerance. Individuals often notice that activities they once performed easily suddenly leave them feeling winded. Muscle cramps are another symptom worth discussing. The kidneys play a critical role in maintaining proper mineral and electrolyte balance. When those balances become disrupted, muscles may cramp more frequently, particularly in the legs. Although cramps can occur for many reasons, recurring episodes may warrant further investigation when accompanied by other warning signs. Poor sleep is also common among people with kidney problems. Some individuals wake repeatedly during the night to urinate. Others struggle with restless sleep, discomfort, or itching that interferes with rest. Because sleep affects nearly every aspect of health, these disruptions can worsen fatigue, mood, and overall quality of life. The important thing to remember is that no single symptom automatically means you have kidney disease. Many of these warning signs can occur because of other medical conditions. However, when several symptoms appear together or continue over time, they deserve attention. Your body rarely sends repeated signals without a reason. There are also practical steps that can help support kidney health. Staying properly hydrated allows the kidneys to perform their filtering functions more efficiently. Maintaining healthy blood pressure is extremely important because high blood pressure can damage delicate blood vessels within the kidneys. Managing blood sugar levels is equally critical, especially for people living with diabetes, one of the leading causes of kidney disease worldwide. A balanced diet rich in vegetables, fruits, whole foods, and appropriate protein intake can support overall kidney health. Limiting excessive salt consumption may help reduce strain on the kidneys and assist with blood pressure control. Regular physical activity improves circulation, supports metabolic health, and contributes to healthier body weight. It is also wise to be cautious with medications. Some over-the-counter pain relievers and certain supplements can place additional stress on the kidneys when used improperly or excessively. Always follow medical guidance and discuss long-term medication use with a qualified healthcare professional. Routine health checkups can make an enormous difference. Simple blood and urine tests can often identify problems before symptoms become severe. Early detection creates opportunities for treatment, lifestyle changes, and interventions that may help preserve kidney function for years to come. Your kidneys may be relatively small organs, but they perform some of the most important jobs in the human body. Paying attention to changes in urination, swelling, fatigue, itching, nausea, breathing difficulties, and other unusual symptoms could help you recognize a problem sooner rather than later. Awareness is one of the most powerful tools you have when it comes to protecting your long-term health. If you found this information valuable and want more evidence-based health and longevity content designed to help you live a healthier life, make sure to subscribe to Dr. Grace Longevity and turn on notifications so you never miss future videos.